The FDA approves first ever self-tests for HPV, the virus associated with 95% of cervical cancer diagnoses. It's an alternative to a pelvic exam, but it still has to be done at a doctor's office, despite the fact that it's actually a self-test, or at least that's what they're calling it. Joining us now to talk about that, some other health topics today, is Dr. Jeff Pothof, UW Health Chief Quality Officer. You know, when it comes to cancer, Dr. Pothof, early detection can be the difference between life and death. We know that. Is that what this new self-test is aiming to do, is provide more access to HPV testing for women?
Yeah, I think you're right. That's what we've been doing with a lot of cancer screening is we need to make it easy and accessible for people to get screening because often it's not high on their priority list. And if we put barriers in the way, they just don't get screened and then unfortunately get developed with more late stage cancer. So this is a step in the right direction. This is typically a screening test that we do in women aged 25 to 65 every 5 years and currently requires a pelvic exam, which most women will tell you is not something that they would do for fun. So having this to be a self swab is a step in the right direction. I think, in the future, what we really need to do is get this to be an at-home based test where you can mail the sample in, get it tested. I think that would further increase the rates of women getting screened for cervical cancer.
At least it seems like it's a step in the right direction. Just kind of have to take another barrier out of there. So many of us that we wear like fitness trackers or Apple Watches, right, that count our steps and the time spent with our heart rate at certain levels. The data shows that this helps people stay active, right?
Yeah, and it shows that, this may sound intuitive, but we haven't had like good literature that says, our 10,000 steps equal to, X many minutes of exercise. And it turns out that they are essentially equivocal. So you can use time. Maybe that's helpful if you're a swimmer or you do some sort of physical exertion that doesn't involve a lot of, stepping or running. But, if you're a jogger or a walker, maybe you play tennis, using your steps as a marker for how much activity you're getting is totally fine. The take-home message is that if we can increase our physical activity, the health benefits are absolutely extraordinary as far as the quality and quantity of life that we get to enjoy. So encourage everyone to just stay active out there.
So many of us have such sedentary lifestyles, whether we're sitting behind a computer at work or we're just sitting on the couch watching TV. The idea is just get moving.
Absolutely. Every little bit helps. And I think sometimes people think exercise is like, well, I got to take 30 minutes, go to the gym. And that's wonderful, but there are other things that we do, chasing our kids, taking the dog for a walk, running errands that increase our physical fitness or increase the exercise that we get that we maybe don't typically count as exercise.
Mowing the lawn this time of year, as long as it's not a rider, because that's just cheating.
Yeah.
Got to be the push behind. There was this new study that came out that is honestly mind-blowing to me, but at the same time kind of makes a lot of sense. Just how much energy it takes for a pregnant mother to carry a child over 9 months. Now I understand why I was just constantly exhausted.
This is absolutely right. So these are researchers that looked at, the total energy expenditure that a woman requires to, make a small human. And it's pretty impressive. 50,000 calories, which is the equivalent of about 25 days worth of energy if you consider most people are eating about a 2,000 calorie diet. What the researchers found is that in the past we usually counted or kind of accounted for the energy needed as like what it takes to make the fetus, but it turns out that's only 10% of the cost. The rest of it is actually to the mother and then all the processes that need to happen in the body to create this small human. So if you're pregnant and you're like, man, I'm exhausted, it doesn't seem like I can even eat enough and keep up my energy, you're probably right.
The wildest part to me in all 3 of my pregnancies is when the doctor said, oh, you're so tired because your blood supply has doubled. That was crazy to me. It's like, yeah, where's it all going?
It is like borderline miraculous how that whole process happens.
No, it really is. Certainly is. All right, Dr. Pothof, we covered a lot today. Appreciate it.
We did. Thank you.